Okay, right now my primary work is as a researcher. I'm in the process of doing the very final stages of the revision of the Ackerman Banks Neuropsychological Rehabilitation Battery. This is a comprehensive neuropsychological screen designed for psychologists who are not necessarily in neuropsychology, but it's the first battery, to the best of my knowledge, that's included an ethnic minority normative sample.
Now, kind of behind that, before that, is your training.
Right.
To be doing this kind of work, you had to have had some specialty trainings. Can you talk about that? Okay,
my real impetus for going into neuropsychology came from my assessment professor in graduate school, Alan Berman, at the University of Rhode Island. And he did all of his assessment training really looking at trying to tease out any kind of brain dysfunction that might be part of the explanation for dysfunction. So I have really been particularly interested in that, but I also have an ethical perspective that it's not appropriate to simply assess a person, but to really try to work on a way to get them into rehabilitation and figure out what will work for them. So the battery is really designed to help people get from assessing what's wrong and then moving directly into rehabilitation.
It's meant then to kind of indicate kind of a pathway to rehabilitation?
Yes, the results actually include a spreadsheet so that people can look at the spreadsheet, look at strengths and weaknesses side by side, and determine what they might use to help rehabilitate the things that need rehabilitating. And it has a checklist that actually makes recommendations for which disciplines to work with.
Wow, that's impressive. And you mentioned that this is your approach is the first one to include work on ethnic minority samples, your subjects that are participants that you work with?
Right. Yeah, it's normed on a clinical sample, and 17% of that sample is African American.
What led you in that direction of working with an ethnic minority sample, wanting to do that?
I've been very frustrated that there just wasn't anything out there that was normed on ethnic minority sample.
Yeah. Is it your sense as well that this is not just true in neuropsychological assessment, but in many areas of psychological assessment?
That's right.
And therapy as well.
That's right. And it's really particularly difficult right now as we're starting to talk more and more about empirically based practice. It's very frustrating that there aren't culturally relevant assessment techniques and treatment techniques for a lot of the people